Good evening, everybody, and welcome to Facebook Friday, which once again this week is not on a Friday, but we're broadcasting to you earlier this week because we've got two very special guests, and our normal time on Friday is 3 o'clock in the morning for these special guests who have beamed into us from the United Kingdom. So we're very grateful and happy to welcome Catherine Bouvier and Kate Quirk, who I'll introduce to you a little bit more in just a minute. But welcome to everybody watching. And just before I go any further, I'd just like to acknowledge the traditional owners of the land that I'm broadcasting to you from, which is the land of the Wurundjeri people of the Kulin Nation. And I would just like to take this opportunity to pay my respects to elders past, present and emerging. One of the things that I'm very grateful for about this land is the Yarra River, which is in the Woiwurrung language is called the Birrarung. So that's something when I go running along the Yarra, that makes me feel very grateful for where I am. So it's Wednesday, the 10th of the 3rd, but this is this week's, I guess it's a second chapter to last week's Facebook Friday, where we really, we heard from a infectious diseases physician, Dr. Patrick Charles, and this week we're really happy to hear from our cousins from the UK who've got some really, I guess, more direct experience of COVID and also the vaccination process, which I know lots of people in our community have been talking about. Just before I introduce Catherine and Kate, I think the other thing that I did want to just talk about out loud is that if you're part of our patient community in our Facebook group, we had very sad news today that one of our very central group members, Helen, died this morning. You'll see there's a candle in the background in my office. You'll probably notice that often on Fridays I'll have that candle burning because of, because I'm using it to remember somebody who has died in our community. And usually I don't mention their name, but I just felt that Helen was such a central member to our group and such an amazing support to so many, and I think really embodied that balance of the perseverance and determination of never ever giving up, and yet really actually coming to a point of acceptance of her own illness and her own mortality. And I have a lot of admiration for people who can manage that with such grace, and so I just wanted to remember Helen and pay tribute to her here in this space tonight. So without further ado, welcome. So Catherine and Kate, now it is morning in the UK, isn't it?
Yes, not too early.
Not too early. So we managed to find a time that we could, was before bedtime for me and was, not too ridiculously early for you. So I feel like we're lucky there.
I know you guys have such an awful time, don't you, on teleconferences? I've often seen the Australian crew there at awful hours. So we're very grateful that you found a relatively decent hour for us.
We're very lucky. So would you mind introducing yourselves and telling us both a little bit about your roles with NeuroEndocrine Cancer UK?
Okay, you go first, Kathy.
Okay, well, I'm Catherine Bouvier. I'm a nurse, neuroendocrine specialist nurse by background, although I'm definitely no specialist nurse anymore, but that is where I've come from. And then I co-founded NeuroEndocrine Cancer UK 15 years ago now. I'm also the current president of the International NeuroEndocrine Cancer Alliance, and I'm halfway through my term there. So that's what I'm doing right now.
That sounds pretty busy. So thank you for making time for us today.
She's definitely busy. You have to make an appointment.
Definitely. And Kate, would you like to introduce yourself? And just before I do go any further, I'm going to turn off my fan because I've realised I've left it on and it's noisy. Just a sec. That's better.
Oh, okay. Look, you need a fan. That's so lovely.
It's warm here.
I know, I'm so jealous.
I know, it's been a long, cold winter in the United Kingdom. So.
Oh my God, sorry. Carry on, Kate.
All right. My name is Kate Quirk. I'm one of the ambassadors for NeuroEndocrine Cancer UK. I'm also a lung net patient. I had a lung primary removed in 2003. I'm a research advocate for INCA, which Kathy introduced me to. And I'm also a patient rep for the PET-CT Academy at the Christie, Manchester.
Well, that also sounds like quite a busy life, Kate.
She's also our NATA coordinator.
I forgot that part, yes.
Yeah.
So tell us what
name-
Azure is, because that sounds like in language that we might not know.
It's the patient support group, and I help our CNS run it with our patients in the UK, and we now meet online, and I help coordinate that. So yeah, it's really good actually. We talk about anything and everything. It can be as wide ranging as monthly injections, fatigue, well-being, motorbikes, red wine, PRRT, CAPTEM, you name it, we've covered it.
I suspect there's a lot of synergy and parallels with what we talk about at our patient communities. And we're also very familiar with the good old Zoom support group meetings currently. So yeah, empathy across the globe. I wondered if, and we've had a couple of questions put in ahead of time from our patient community, which is fantastic. But I wondered, because we've had so few patients, a few people here actually in Australia diagnosed with COVID, I think for some of us it can feel a little bit remote. And I wondered whether you could share whether anyone in your patient community in the United Kingdom has experienced COVID over there.
Yeah, you might want to allude to that, Kate. Yeah, well, we have had patients experience COVID, and we have had patients talk about it, certainly within our support groups, their kind of experience of it. There has been a difference, but I think that's no different to our patient community to the general community in terms of the sort of the response to the virus and the severity of the virus. I think it has been different. And I think there's so many different aspects of our own personal health that seem to have an indication as to how the virus is going to affect us. So it's had that similar sort of disparity amongst the population. So, and I know that Kate, they've talked about it in support groups, those that have been affected or have had COVID.
There was a lot of fear in the beginning because obviously, like everybody, we didn't know what was happening, and we didn't know whether our neuroendocrine population would be overly detrimentally affected. We just didn't know that. Nobody did. But I think it's like anything, when you don't know the facts, your mind is overactive and you think the worst. But we've definitely got people in the support group who have experienced it, and that I think that's across the board for everybody. Personally, I was told to clinically shield for the first 2 lockdowns. We've had 3 lockdowns in the UK. So for the first 2, I came on what we call the clinically extremely vulnerable list, because I'm a lung net primary, and also because I was just at the tail end of PRRT. So I was on that list. But yeah, we definitely have people in the group talking about it constantly, and now the vaccine has begun to be rolled out. That's a constant question patients have all the time.
And I feel again like there's some parallels, but that it was a much more perhaps real experience for you over in the UK because of the large numbers of the general public who had COVID. Do you know people who have had COVID? It's probably a silly question, isn't it, really?
Yeah. Do you know, in the first lockdown, I think you were saying earlier that it felt a little distant or a little remote to you guys because of the few cases that you had. But I think there was a kind of sense of that way back in March, because I didn't know anybody, and you're kind of just sitting at home going, well, I don't know anyone who's affected, so I don't know, it looks awful, but I don't know what's happening. And then as the disease progressed and we got further variations and our numbers obviously even further increased, then I began to know people. So my brother became very ill, and he now has long COVID and has lost 20% of his lung function.
Oh, I'm sorry.
And then I've got, friends who have lost parents through COVID. And then suddenly you start meeting and hearing people more and more who have been affected or have been quite unwell. And even some young people who were quite affected quite badly, sort of children of friends of mine. That I kind of thought our uni lot were all right, if you know what I mean, but there were a couple that had quite a tough time of getting through it, really. So yeah, I began to know more and more as time's gone on, but certainly at the beginning it felt a bit unreal, I think, for most of us.
And has it been similar for you, Kate?
Yes, very similar to what Kathy said. Sort of in the first lockdown we had, I didn't really know of anybody. I wasn't hearing those sort of stories nearby in the community where I live. There was very little information that you could relate to at first. But as time went on, and we were in quite a dire position, sort of at the end of the first lockdown, and it got a little bit worse. But yeah, it was a bit surreal in the beginning. It's surreal.
And so I wondered if you could, we will move on to the vaccine fairly soon, because I know this is probably the pointy end of the conversation that everyone wants to hear about. But I wondered if you could describe for me the sorts of disruptions that people with NETs have had in the United Kingdom as a result of the COVID pandemic.
Well, I think, I mean, there's a lot of data that's been produced by probably some of our big charities across the whole cancer spectrum. So they have talked about, huge drop in numbers of patients going to see GPs. So there's been a massive delay and drop in kind of early diagnosis of cancer. And there are some quite startling figures there. I think just in England alone, Macmillan, who's one of our big cancer organisations, said that there were potentially sort of 40 to 50,000 missing diagnoses in a small period of time last year. That was only in like a few month period. So, but in terms of sort of specifically for the neuroendocrine community, we haven't got huge amounts of data, but we did do a small snapshot survey that was about 360 patients. And really, we asked those questions in terms of, how much of your care had changed, scans, access to bloods, access to your care team. And we got quite an interesting response to that. But, about 55%, maybe 60% said that their care had been disrupted in some way. But a really small proportion actually had a disruption to their treatment plan unless they had chosen to not have a particular treatment till after COVID. So that was quite encouraging. Although, and it seemed to be that a lot of the community issues were of paramount importance, like getting your bloods and screening and stuff like that, which was all halted here. So a lot of screening programs were completely stopped. But I think the highest, sort of the biggest result out of the survey was really about the kind of psychosocial issues that patients were feeling. And it was quite outstanding, really, to see some of we allowed free text as part of the response to this question. And just some really, you could just really sense this fear of, I'm not having my scans, I've got a delay in my scan, or I haven't had any bloods, and I don't know what's going on inside me. And I'm sitting here with metastatic disease, and every turn and every bit of pain, is that my tumour growing? Or is that just me having a stomachache today? And there was an awful lot of that. And that was our biggest output from our, obviously a small survey of only over 300 patients, but it was quite a dramatic response in comparison to the treatment and diagnostics. So that was something that we fed into, both our government and some international COVID reports that have come out saying, we've got to think about how we build up resilience again. Our community lives so much with uncertainty as it is, a complex cancer, not quite sure about kind of those treatment paradigms and which treatment comes next and what's going to happen down the road. And this kind of seemed to compound all of that. It's like more uncertainty. And I felt very bad about that.
And Kate, I imagine that these experiences would have been echoed through the conversations in the support groups.
Yeah,
as well,
the only thing I would add to that, we did, and this was my experience as well, we did definitely have a difference in region of the UK, according to, London was obviously our major hotspot, and patients were reporting almost a complete cessation of what was going on down there for their treatment. But I'm in the north, and my treatment, my scans and follow-ups didn't stop. I was very lucky, but the hospital that I visit was, what do they call it, Kathy, a cold hospital, where it was, there was no COVID being taken into that hospital. It was a dedicated cancer centre. And when I was going in for scans, they were saying, we have to deal now with patients' fear of coming into a hospital, but we're a safe zone, and hospitals around the UK also followed that. But there was a problem encouraging patients that it was okay to go back into their hospitals and to their centres to restart their treatment, and that precautions and measures had been taken to make it safe. So it was sort of quite difficult to restart things again once we began to sort of emerge a bit from the shock and fear of it all.
And I think that fear of going into a hospital is still there.
Yeah, definitely.
I know that in Australia we were worried about, we had endocrinologists who hadn't, worked in any kind of intensive care environment for decades, and they were needing, and they were reskilling in intensive care techniques and looking after very, very, very ill patients. And we were worried about, our oncology staff having to divert their services to looking after people with COVID. We were sort of preparing for that. Did that actually happen in the UK, where oncologists and your specialist doctors had to kind of pivot to looking after COVID?
Yeah, redeployed, and a number, of course, we had dedicated sort of new hospitals that were set up in kind of big arena spaces, so people were being prepared to be deployed there. But I mean, a couple of hospitals, in fact, we worked with, because the specialist nurses were being deployed onto the wards, and so we said we'd take their phone calls, for example, so that we were covering the fact that they weren't there, so the patient didn't actually have kind of a point of contact from the nurse perspective either. And it felt like, if there was something that we could do just to support that, we might not know the ins and outs of their disease or have their scans or bloods to hand, but at least we could be someone to talk to at the other end of the phone, and then feed through any concerns to the nurses at a later stage. But that felt like a really important piece of work out in the community. It's very frustrating for them just not being able to be in their units, because they had to go off and do other things. And that was scary for them as well. Yeah.
It's like any situation, isn't it? If you don't get given the right information, or if you don't get given some facts or some guidance, you worry about the most awful things going to happen, because it's the absence of the information that makes your mind work overtime, and you just think and think and think. It's like Kathy said before, every little pain or headache or ache, you think, well, this is it, it's terribly serious. And chances are it's probably just something that a person with no disease would experience. But in the absence of having the correct information, we just think the worst, don't we, all the time? So, and as a neuroendocrine cancer patient, you definitely think the worst in the absence of information.
So it sounds like it really intensified lots of the worries and struggles that people with NETs in the UK had regarding their NETs, and so it made the anxiety around scans and things much more difficult to manage because of the delays and the fear of going to the hospitals and things like that. But then we had this extra layer of worry about catching the disease and the impact if we caught it, and the impact on loved ones. And I want to talk about the vaccine experience, if that's all right with you, because I think that's the point that we are at in Australia. And I went to a meeting today, and they quoted some figures that were worldwide. As of yesterday, there were 305 million vaccines that have been provided, which is extraordinary. But 23 million in the United Kingdom, which that's quite a lot of people. And so I guess when we were talking with Dr. Patrick Charles last week, and he was giving us information, it feels quite theoretical, and there are some anxieties. And I wonder, Kate, maybe if you could share from your experience what that was like as a NET patient approaching the question of the vaccine, and how that decision making was for you. And sorry, just before we go on, I forgot to give the disclaimer at the very beginning. I'm a shocker for forgetting to say this, but obviously for your own situation, please talk to your own doctor. We're not giving, personal medical advice, but please do talk to your healthcare team about your own situation. So, Kate, sorry.
Well, I was very skeptical at first. I was in no rush. My son was the pusher for wanting me to go ahead and have the vaccine. I was quite reticent. I didn't particularly want to chat about it. I felt that it had perhaps all happened so quickly because, you know, we're all looking for some sort of miracle cure for NETs, and here they are rolling out this vaccine within about 12 months. So I was quite cynical, and I would say that I was reticent. But as time went on and I was reading and researching as much as I could find online myself, and because I'd been on the clinically extremely vulnerable list, I knew which list I was in, and my PRR treatment had pushed me into a higher up list. So I knew that unless I was going to say no to it, I was going to have it be offered it very early. And after taking everything into account, not least anxiety. So I had anxiety about being early. I had anxiety about how fast it had been developed. I then had anxiety about which one would it be? Would it be AstraZeneca or would it be Pfizer in the UK? And what did that even mean? And, you know, it's ironic because you have NETs, so you have to take drugs whether you want to or not. So I'm already taking lanreotide and thinking, oh, here comes another drug. What's this going to do to me? So yeah, at first I would describe myself as very trepidatious, but I was eventually offered it on the 20th of January. And by then I had come to my own conclusion that I did want to have it. And I'd been reading as a lung NET patient what COVID might do to me if I did pick it up. And I realized that there was quite a good chance that I would have a serious problem on my hands, being a lung NET patient and having COVID as well. So on the balance of all probabilities and weighing everything up for me, I went ahead and had it. So.
Kate, can you tell me, do you know which vaccine you had? Because we've got exactly the same two vaccines on the go here.
So. Yeah, I had the AstraZeneca vaccine. We call it Oxford or AstraZeneca vaccine. So, but I definitely had 24 hours of feeling pretty rotten. I was prepared for that though, because a lot of people had been reporting 24 hours as if I felt as if I had full-blown flu just for the 24 hours. But it was weird. As soon as that day, which I just spent on the sofa watching, you know, a good movie with a duvet, the next day I was absolutely fine, which surprised me. So yeah, and I would do that again because I do feel that I am protected. I feel a bit more relaxed now than I did before. I wouldn't take unnecessary risks, but I definitely feel a little bit more relaxed.
Kate, I'm wondering, have you had your second vaccine?
No, and that was another point of anxiety because in the beginning of our rollout program, when everybody thought that they were going to be on the 12-week or 3-week gap for the booster, I thought, well, that's okay. I've made my decision. I'm going to have the next one. And our plans changed in the UK. So that was a cause for a little bit more anxiety. But by the time I'd sort of processed that, I was okay with that. And I'm scheduled for my booster in 3 weeks' time, I think it is.
Kate, it would be wonderful if you could drop me an email and let me know how you go after that booster, if that's possible. I know that our patient community will be really hanging out to hear what that experience has been like for you. And we're so grateful to you for sharing not only your experiences of the vaccine, but actually your anxieties around it and that process that you've gone through making that decision, because I feel like this is exactly where our patient community are at the moment. So it's so topical and it's really...
Also, I did sort of, once you sit down and think about what's right for you, I did have my son's consideration to think of because, as a family, he already has to deal with me having neuroendocrine cancer. So that's quite something that he has to share through no choice of his own in our family. And I'm his mum. So, there was more than just my decision in the melting pot. So that was a factor as well. And whilst he would have respected my decision if I'd have said, I'm not having this, I wanted to do the right thing for my family as well. So that was important that all the aspects were thought about. But also I began to really think about what would I do if I had COVID? How would I manage? What would I be like? I had a lower left lobectomy in 2003, so I have a compromised lung function. So, I began to think maybe I'd be a little bit foolish here if I put myself at risk with the health condition that I have. So whilst everybody is different, some people have had a Whipple, some people have no spleen, we are all very different. You have to make your own decision, but I think it's the right thing, because if you have neuroendocrine cancer and then you have COVID on top, it's a big deal for your body. That's where I was coming from with it. It's a lot for your immune system to cope with.
Yeah, and I think also there's like such a stark, really horrible and scary death toll here in the UK. And it really sits in my mind, just when you see it on the news and the numbers just go up, and it's quite horrifying. And you just think, I've got to try and do what I can do to not, one, be part of that number, but two, have no one around me that's part of that number too. And I think that's kind of where you sit as well, in that there's a fear factor to it.
Yeah.
Has that fear abated at all now that so many people have had the vaccine?
I think if we could just get out and do something and maybe see one another, which we still can't do until the end of the month, when we can, I think, meet more people in our garden. I think maybe 6 people or something, or 2 households. I don't actually know, the rules are so confusing. I think then we'll start to feel a little bit like this has worked, and we know that all these people have been vaccinated. And I think it's probably more real for Kate, as she's had her vaccine, whereas I haven't.
I was going to ask you that, Kathy. So
yeah,
you haven't had yours yet.
No, so I think when when you haven't been vaccinated, I've now got that fear of, I don't want to give anything to anybody else, and I don't, which I would hate, and even if I was not asymptomatic.
Yeah, see, that is
so
that factor.
And I hate the thought of that.
My goddaughter had a COVID test for a poorly auntie, and she had absolutely no symptoms whatsoever, and she tested positive. So that was a quite close to home experience, because she was perfectly normal, as are some people who are walking around as carriers of COVID, and you have no idea, and she had no idea. And then also I have a very dear friend, a very robust chap, and he had COVID very, very badly in February last year, and he was really, really poorly, but a very strong physical person. And then he had the vaccine, he had the Pfizer vaccine, and again had this 24 hours where he felt quite poorly. And you would think, well, as he had a bad case of COVID, was that any protection to him? Nobody knows these things for the long term, but he had the vaccine, he was glad he had the vaccine, had the reaction, and now, feels as protected as he's going to be. So we don't know long-term facts, do we? Nobody does yet, but I think we've just got to do the best to try and protect ourselves.
And it's like so many things, I think, with cancer. We actually don't know what's around the corner. It's just that this is a new thing, that it's a new corner, and so maybe it's that we get accustomed to the same old, uncertainty that we're living with neuroendocrine cancer, but this is a whole new thing. And so I feel like there's almost a resentment, like, it wasn't neuroendocrine cancer enough, and now I've got to make a decision about a vaccine. And
but I think that's understandable, isn't it? I mean, it just feels, it's not like neuroendocrine cancer is cut and dry. It just isn't. And we've seen that from all of the meetings and research that's been done. Kind of ultimately always finishes with more research needs to be done in order to completely conclude whether this works or this doesn't work. And you just think, oh my God, this is constant. It's just a constant, I don't know. And the vaccine isn't offering an I do know, it's offering
more I don't knows.
More I don't knows. And that's really hard.
That's very true.
That's hard for everyone.
I did feel quite angry and resentful that I was sort of surviving neuroendocrine cancer and doing everything I could to sort of be active and healthy and normal, as they say. And then along comes this virus, and I'm thinking, God, if this one's not got me, the second one's going to get me. So it was quite angry that that was the case, you know, that I had to mentally deal with that as well. I definitely was angry about that. But I do feel now that I've done something constructive to protect myself. That's how I feel about it.
Yeah,
that's important for you. Yeah.
And I imagine, Catherine, for you, that's that waiting into it sounds like I might get a vaccine as a health worker before you get yours.
I have no idea when I'll get mine. I know, who knows? But I mean, I guess they are ramping through people. They are getting through people quite quickly in terms of, obviously we've got like a few million that have already been done. So I'm hoping that they'll just carry on at the same speed. But the speed's an issue, you know. We've actually got 3 vaccines here, I think, in the UK that have been approved. And I don't think that helps. I think if we just had one, that would almost be easier. There's a case that again adds a little bit of, you know, that one could be better than that one, or that one could be, you know, worse than that one. Again, that's things that I think sit on people's minds. Don't give me a choice. Now I don't know what to do. Or you don't get the choice, do you?
Yeah,
I think it just depends, you know,
no, you don't.
Depends where you are and
then, of course,
what your doctor's got.
You hear some people say, you know, like I had the 24 hours dental, and then other people just, you know, walk off and perfectly normal. And you think, well, why is that? Why has that happened? Why can't I be one of the ones that has just walked off into the sunset? Oh no, I have to have 24 hours on the sofa feeling rough. But compared to, you know, however COVID might last, I'll take the 24 hours on the sofa, thank you. You know, and you just don't these things for sure and how you're always going to be, so it's quite hard.
Kate, one person in our group who's watching via the Facebook live feed has said, does UK Kate, thank you for specifying, UK Kate, because there's a Kathy and 2 Kates, it's a
this is a nightmare.
Parents with extremely good taste, what can I say? Does UK Kate still wear a mask after being vaccinated when going out?
Yes, definitely. Yes, I wouldn't. For me, that's not a risk that I would just take. For me, that just seems, why would I not?
Yeah.
I mean, if I go on a dog walk or something like that, I wouldn't. You know, by myself.
Is that
or with a family
still
member,
in the community that people are? Is it law that you're wearing masks?
Yeah,
inside.
It's the rule. Yeah, it's the rule. You know, if you go to our supermarkets or if you have reason to go to our GPs or whatever, you would wear most definitely a face mask. You wouldn't be allowed entry without one. And I think that's right at the moment.
Yeah. I think it's most places in Australia, it's quite relaxed now. In Victoria, where we had the worst outbreaks, it's we've relaxed a bit more. We're still wearing masks in supermarkets and shopping centres and places like doctors' surgeries where you can't physically distance. But I think masks are fairly widespread, and it's interesting that you're still wearing one post-vaccine. So thank you for sharing that. Yeah. I wondered, we're nearing the end of our available time, and I'm so grateful, Catherine and Kate, to you both for joining us early in the morning in UK time. So if anyone else has any questions that they would like to put in the chat box, now's your opportunity, because I've just got one more question that I wanted to ask you both, if it's possible. Just what would be your advice to people in Australia who are affected by neuroendocrine cancers, you know, having been through what you've been through in the UK, both in terms of the, you know, huge numbers of people who've had COVID and your extended lockdowns and the impact of that all on the community, and your experiences with the vaccination process? What would be your comments? What would be your advice to us down under who are a bit earlier on in that, particularly in the vaccine journey?
Oh, blimey. Well, I mean, I don't know, in terms of the vaccine, I think it really is about understanding what's the best thing for you, and to understand and research and be clear in your mind as to, you know, the risks and benefits of vaccination, because I think that's important. I think to talk about it, which is something again that Kate did, talk to the family, and ask your healthcare professionals and those around you and the rest of your community. You know, I think that the conversation part is really important, but I think you know, one thing that's been really amazing for me in terms of this awful scenario here in the UK is I think the community have been a huge support structure. And they have, you know, been together, and they have, you know, supported one another, and, you know, not just through support groups, but through various other initiatives. And I think that's been quite amazing. And I hope that that's something that we can continue, along with, I think, you know, just silly things that you realise is, you know, good respiratory hygiene, how important that really is, and how sometimes one forgets those simple things, you know, about putting your tissues away and washing your hands, and, you know, people, you forget, you go back into that lull of, you know, perhaps not thinking about it so much, but, you know, these viruses and these bacteria are scary and clever and manipulative, and I think there's a lot that we need to be doing to ensure that we never have to go or be in this place again. But I think communication has been the biggest disaster for us. I think, Kate, would you agree? I think that's something that we've all struggled with, not really knowing what's happening, when, how and why.
Yeah, and particularly around being a cancer patient, what group do you fall into? Why are you in that group? What is the treatment that you are on? What's that done to which group you're in? You know, we had very confusing information at the beginning, and really all cancer patients should be pretty near the top of the list. And that wasn't the case. So that caused a lot of extra anxiety, which our community just did not need. So, and the other thing, go on.
I was just going to say, you know, if you've got questions, I think, especially around the vaccine, I do think speaking to your healthcare teams is really important, because they will have had, you know, they have got knowledge about sort of vaccination programs historically. You know, we've had flu vaccination programs going for not that many years, but for many years. So, you know, there are programs that have been around prior to this COVID vaccine program, and I think they're the people that have, you know about the research and have looked into this, and are trying to understand the impact for their patient community that they work with. So I think that's really important that you have those conversations. I think it just might relieve some anxiety.
Yes, I'd agree with that, because I wouldn't have hesitated to have the annual flu vaccine that comes out in the UK very normally. You know, we take it for granted. Around about sort of September, October time, our community looks to see when the annual vaccine for flu is available. And, you know, the UK rolls that programme out very matter-of-factly now. And I wouldn't have hesitated to have that one. So, you know, that also made me think, well, hang on a minute, Kate, why are you hesitating for this one? Which I did. And as I said earlier, my hesitation was around the speed with which it became available, and then an understanding of why that had happened. And it was fantastic that we could get that. Otherwise, we'd all still be sitting indoors, wondering when on earth we were going to see light at the end of the tunnels. So that was. And the other thing, just by sheer fluke, that I was offered the vaccine sort of within the day before, ready to have it the next day. What Kathy said then about keeping in touch with your team is so vital, because on the hoof, I just thought, right, well, I'll email my team to say, I've got this opportunity, what do you think? And to my absolute amazement, my consultant emailed back, said, go for it, don't hesitate if you have the opportunity. So I thought, well, I'll take that. I didn't really expect a reply at that point, but as I knew how busy everybody was. But always keep in touch with them, because, you know, mostly they're there to help in as timely a manner as possible. So
I think that's really great advice. So from both of you, so thank you. There was one follow-up question for you, Kate, about masks. We seem to be quite interested in masks here. Do your close family members wear a mask because you have nets? And I'm imagining the person who's asked that is thinking that that's talking about in the home. But
in the home, no.
No, not in the home.
Not in
what
my
about
home.
if someone's like if you've got family members visiting, or you can't visit at the moment, can
You're not
you?
allowed to.
Our UK rules.
Sorry.
We don't see it.
Oh God.
That's just cruel, Kate.
I'm so sorry. Here I am with my fan on and my t-shirt in the Australian summer and talking about visitors.
Well, our UK rules are that you're not allowed to have a visitor in the home at the moment, but if somebody was to come and we had a coffee in the garden, no, we would not wear masks in the garden. But our rules, like Kathy said, our rules have changed quite quickly and quite often. And we are left thinking, mask on, mask off, you know, friend in, friend out. We have got a
Which
bit.
law is it today?
It has been confusing.
Well, we're getting right to the end of our available time, and I'm so grateful to the two of you for joining us this evening, our time, and this morning, your time. Along with I guess the advice to get more information is very timely, because today in Australia, the peak organisation for cancer overall in Australia has published some frequently asked questions and an updated version of those frequently asked questions with a whole lot more detail about the rollout of the vaccine for people with cancer. So there's been a great deal of clarity that's just come about in the last 24 hours regarding that and regarding which group people with cancer in. I went to a meeting this morning that really very much confirmed that anybody with what we would consider metastatic disease, so anyone with, you know, anything that we can see on a scan certainly, would be in Australian terms, it's phase 1B, which starts its rollout from the 22nd of March, so about 12 days away. So I will make sure that all of those documents and references and things are in the notes for us after this video. I just wanted to give a quick plug to next Facebook Friday's session, which actually we've got a patient joining us from Queensland, Kathy, who has really kindly offered to share her experience. Another Kathy, it's a great name. What did I say? Kathy's recently had cardiac valve replacement for carcinoid heart disease, and I know this is a subject that comes up in our group conversations quite regularly, so I was really grateful when Kathy agreed to share her experiences of that major surgery and what that was like for her. So that's next week, and we will be on the Friday next week. We're back on track for Facebook Fridays on the Friday, but thanks everyone for your flexibility. I thought that it was really worthwhile, both last week and this week, taking advantage of having some very special guests available to us. So so Catherine and Kate, hope you have a wonderful day. Look, we're just thinking of you. We were joking about it before, but having lived through lots and lots of weeks of lockdown in Melbourne, I have a small sense of what that's been like, and just the thought of being able to go for a coffee or a glass of wine somewhere that's not your lounge room, you know, I really empathise with that, and I you know, you've had it during a, you know, Northern Hemisphere winter, and so I just our hearts go out to you. We're very grateful for your generosity tonight, and wish you all the best. Catherine, I hope you get your vaccine soon, and all the best for your second one, Kate. And
Kate, thank you. Thanks very much for inviting us.
It's a pleasure.
You know, what a great initiative to do these Facebook Fridays on a Wednesday, I know today, but
just to make everyone feel very confused. And there's lots of people just indicating their gratitude in our comments section on the feed. So just passing those on to you as well.
I mean, you know, it's just one thing about, you know, we talk about our local community, but, you know, again, it just brings to light the importance of our global community too, you know, and the fact that we all know each other and that we can just email each other and say, hey, will you come and have a chat? I think that's just so important, and I feel very, very honoured to be part of that community. So, you know, again, thank you for inviting us too, and, you know, we'll be in touch.
Fantastic. Well, thank you, everybody. I'm going to end the live video now. I look forward to seeing you all next week.
Thanks so much. Bye.
Bye-bye. Bye.